Hello, I'm Ronald van Vollenhoven, and I had the opportunity to speak about a topic that concerns many clinicians, rheumatologists, but also concerns the patients, and it's how to choose wisely between the different treatment options. And specifically, if one has to choose among the biologicals, how to choose wisely? Well, I started by saying in my presentation that choosing wisely always means you have to have a lot of information available in your brain. So the brain makes all these important decisions. So you have to have all the data, all the information. That's why a congress like this is also very good. And then you can say that, well, right now, the recommendations for treating lupus include the use of the biologicals that are approved for lupus, which is belimumab and anifrolumab. And in the EULAR recommendations, it actually says that those can be considered fairly early on. Not, of course, for patients who respond well to antimalarials and some glucocorticoids, but if it doesn't work that way, then you could already consider the biologicals, in addition to also considering many of the more older conventional immunosuppressives, such as methotrexate, MMF, and azathioprine. Now, how to choose the biologicals? Well, you have to know what they can and cannot do. And I pointed out that there's a lot of literature on, for example, on belimumab, how it decreases disease activity, it prevents flares, seems to have a modest corticosteroid sparing effect. It also seems to be able to prevent some of the damage that can occur with lupus in the long run. And anifrolumab also has shown that it can reduce disease activity, that it can prevent flares. And it seems to be particularly effective for skin manifestations. And it can also reduce the need for glucocorticoids. So these two drugs both have very good positives. But we also have to be fair about some of the limitations. And of course, the effects are not always 100% for each patient, so there's clearly variability in the strength of the effect. For some of the medications, we think that we can see a little bit of difference for the organ manifestations. So, for example, belimumab has really been shown to have benefit for lupus nephritis when added to conventional therapy. That has not been shown for anifrolumab. Anifrolumab seemed to have very excellent efficacy for the skin manifestations, but perhaps a little bit less clearly so for the joints. So there are some subtle differences. And by weighing all these different aspects, the pluses and the minuses, I think in the end we will be able to choose more and more wisely for each individual patient.